Thank you for inviting me for this session. I'm going to talk about the case of missed ocular torticollis. Torticollis is mean twisted neck. The most common cause of ocular torticollis is a congenital muscular torticollis. It refers as a spasm, contraction, or fibrosis of the sternocleidomastoid muscles. The congenital one started at birth or a few weeks after birth. It must be differentiated from the acquired causes of torticollis, like osseous or ocular torticollis and muscular dystonia. Diagnosis of torticollis is primarily clinical as twisted neck associated with restriction in the range of movement of the neck muscles. Ultrasonography can be used to detect any neck masses or to evaluate the progression of the treatment. The treatment of the muscular torticollis or congenital muscular torticollis is primarily physical treatment with stretching of the contracted neck muscles. Botulinum toxin injection can be used to relieve the stiffness of the muscles. My case is 8 years old boy attended to my clinic. So he was coming for just dryness of the eye. Father reported absence of any ocular disease. As I spoke with him about the head tilt, he told me he is under treatment since 2 years in the physiotherapy clinic, and it is proposed to have botulinum toxin to the neck muscles in the next few weeks. On examination, there was a left hypertropia, which is corrected with prism, and you see here the tilted neck improved after putting the prismatic correction. The left hypertropia was about 14 prism diopter. There was a right increase of the vertical deviation in the opposite gaze, as well as increase of the vertical deviation while tilting the head to the left side. I have done for him left superior oblique tucking as well as with inferior oblique recession. This post-operative result shows alignment of the eye in the primary position as well as improvement of the action of the superior oblique muscles and the decrease of the elevation or the inferior oblique muscle overaction. 6 months after the treatment, there is stability of the findings. Ocular torticollis is a compensatory head posture. It is used to prevent double vision and improve the vision and treat some cases of nystagmus. Superior oblique muscle palsy is the most common type of ocular torticollis. The cause of superior oblique muscle palsy is usually congenital absence or hypoplasia of the fourth nerve nucleus. Diagnosis of superior oblique muscle is diplopia in primary position associated with his tilt. There is hypertropia of the affected eye. The golden standard test for the superior oblique muscle palsy is Belchowski 3-step test, which is hypertropia of the eye in the primary position. Vertical misalignment will be greater when looking to the opposite side, and vertical deviation will be worse when the patient's head is tilted to the same side. Rotation can be tested by double Maddox-Roth test. The treatment is mainly surgical in the form of strengthening of superior oblique muscle by tucking or advancement, inferior oblique recession or myectomy, or combination of both. Long-term torticollis without treatment can cause a permanent contraction of the neck muscles and craniofacial asymmetry. The take-home message is ophthalmology consultation should be done when early onset for congenital torticollis is diagnosed. Early optimal diagnosis and treatment of torticollis should be made to avoid a permanent complication in the future. Thank you.